Hello everyone, very good evening to all of you. Welcome to the next session of the high yielding topics. Hi, Dr. Amren, I'm audible and visible to all of you. Hello Abhilash, hello Rupam, hello everyone. Oh, thank you so much, Lamesh sir. Very good evening to all of you. Blessings to Surya, very good. So I think you all have come. So yes, so we will start in this. So as I have told you already, these are the important high yielding topics which you try to revise from your class notes also, and try to make tiny notes. Whatever I'm going to teach you will be shared in my Telegram group also, all the PDF, whatever I'm going to teach. So you can go through and you can revise, right? I will be posting you question. I will be giving you, approximately 30 seconds so that you can answer in between, and then we will see how much answer you are giving correct. So here I will tell you one thing, that even if you're not giving a correct answer, you don't get hurt or don't feel down, because it's okay. Even if you are giving some wrong answer, it's okay. You are learning. If you are committing mistake here, you will never commit mistake in your in your exam. So that's what I wanted to say. Thank you so much, Muskan. Thank you so much. So this is how we are going to start. These are the topics which I am going to discuss. These are all previous year questions, right? Or previous year question topic, I should say. Precisely, it's a topic. So that's what I wanted to say to all of you, right? So let's start. Question number one, right? In front of your screen, it is a 22-year-old male with gynecomastia and increased serum level of follicle stimulating hormone was showing karyotyping as shown below in the image, right? So now you can see there is a karyotyping ideogram. This is called karyotyping ideogram, right? So in this karyotyping ideogram, by seeing, first you think about the diagnosis, right? Then you have to read the question very carefully, right? Please remember, in your exam, you, because you have knowledge, we commit mistake because of lack of attention to the last few words in the question. Remember, last few words where they'll be writing except, not correct, right? So like all that thing. So see, the question is, which of the following is the most likely correct statement about this disorder? So now you tell me. I want to see that who is giving me the first correct answer. Right. So very good, very good. First correct answer I had got from Abhilash Singh. Right. Abhilash has given diagnosis also. See, if you look at this karyotypic ideogram, so we call this as a karyotypic ideogram. So this karyotypic ideogram, your diagnosis, how you will do, how to approach karyotypic ideogram. Never jump to the chromosome number directly. Go one by one. One, two, three. Any abnormality? No, no abnormality. In this line, any abnormality? No abnormality in the chromosome. All are paired. 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 Oh, X is paired. Now understand. This is how you have to watch in your exam, right? So don't jump to the 21 and see and one and then and there you try to diagnose. So there are two X chromosome, one Y chromosome, right? So totally 47 number of the chromosome, right? There are two X and one Y. So 47XXY. So what will be this syndrome? Our diagnosis is Klinefelter syndrome. Klinefelter syndrome. Because you can see, as I have shown you here, there are two X chromosome and there is one Y chromosome, right? So it is Klinefelter syndrome. So examiner has given history also. If you look at the history, in history also you can see there is a gynecomastia and FSH level is very high, right? FSH level is increased. So this is going along with karyotypic ideogram of the Klinefelter syndrome. And remember, Klinefelter syndrome, see one by one, no risk of leukemia. Do you think that there will be no risk of leukemia in Klinefelter syndrome? So there is a risk, right? So Klinefelter syndrome, they have increased risk. So this is a false statement. False statement. No risk of mediastinal germ cell tumor. Mediastinal germ cell tumors are very common in Klinefelter syndrome. So remember, they have increased risk of leukemia, right? Increased risk of leukemia. They have more commonly associated with mediastinal germ cell tumor, mediastinal germ cell tumor, and most commonly it is teratoma. So mediastinal teratoma will be common in Klinefelter syndrome, right? Yes, very good. Shalini is telling correct. Teratoma, most common mediastinal germ cell tumor will be teratoma in this Klinefelter syndrome. So this patient will be commonly having teratoma. So this is a false statement, right? This is the false statement. No risk of mediastinal germ cell tumor. No cardiac abnormalities. So that is also a false statement. They will have cardiac abnormalities, and usually or commonly they will be having mitral valve prolapse syndrome. So M.B.B.S is common in these patients, right? High estrogen level. So in this patient, that is the correct statement. This is the correct statement because of the high estrogen level only they will have this gynecomastia, right? So that is one correlation you can see in this question. So please remember, in this patient you will find FSH high, LH high, and they will be having high level of estrogen, high level of estrogen, and they will be having decreased level of testosterone. So these are the important hormonal level which should be kept in our mind in case of Klinefelter syndrome, right? So now you understood. So what should be the right answer? Answer is D. High estrogen level will be there, right? Now coming to the some important point about the Klinefelter syndrome, if you want to know that. See, they are usually male patient, right? And how they will be coming to notice by because of the infertility, right? So we will say that hypogonadism, male hypogonadism will be there. They will be having more than two X chromosome and more than one Y chromosome, and they will have this kind of, this is the most common. So remember, this is the most common cytogenetic change you will see in the Klinefelter syndrome, right? Apart from, so as I said, they are having hypogonadism, so they will have male infertility, right? So infertility will be there, gynecomastia because of high estrogen level, testicular atrophy will be there, and the most important thing which you should remember is the level of hormone which examiner had asked in earlier exam, right? So what will be the level of hormone? Testosterone is down, so testosterone will be decreased, but FSH, LH, estrogen, all these level will be increased, right? And cardiovascular abnormality will be there. And what is that cardiovascular abnormality? Mitral valve prolapse syndrome. This cardiovascular abnormality is most commonly seen in Marfan syndrome, right? In Klinefelter syndrome. See, this is the some of the images which you must look at, because examiner may ask you. See, if you look at the face of this, adolescent baby or adolescent kid, you can notice something, that facial hair is sparse, right? As I said, adolescent, so he should have more facial hair. So facial hair is sparse, means scanty, less amount, right? And see, another important thing, can you see the philtrum, this area that is called philtrum? Philtrum is very short, so we can say that short philtrum will be there, right? You can notice jaw is coming out, so this is called prognathism. Jaw is coming out, right? Gnatha means that jawbone, pro means coming out, right? So this is protruding jaw, prognathism. So sparse facial hair, prognathism, philtrum will be shorter. This is one of the important clinical finding you can see. And you can notice here in the axilla also, axillary hair is also scanty, right? And there will be a gynecomastia, there will be a gynecomastia. And if you look at the adipose tissue distribution, is like a feminine distribution, of adipose tissue will be there in Klinefelter syndrome, right? So now coming to the next question, this is again a very high yielding topic, and you will get one question from here, right, in your NEET PG or FMG exam both, right? So now you can see finding of a patient is given here, right? All are true about this anemia except, so finding is given 1 2 3. So these are the three findings you can see, right? I have shown you three important images here, 1 2 and 3. Two are radiological, one is peripheral smear. Yes. No, it's not multiple myeloma. See, already I have written it's anemia. It's anemia. See, already it is written anemia. So this is not multiple myeloma. And this okay. Though, so first correct answer is given by Anu, and this is D, right? So correct answer is D. First correct answer given by them, right? So first of all, we will see what are the findings I have shown you. You can see there is a skull inner table and skull outer table, right? And on this skull, you can notice there are bony spicules which is perpendicular to the surface of the skull, right? So what is this called as? Looks like hair, fine hair like bony spicule. So hair on end appearance, right? So this is also called a hair on end appearance. Hair on end appearance, right? So this is hair on end appearance or crew cut hair appearance. You can also call this as a crew cut hair appearance. So hair on or crew cut appearance, this is not very diagnostic of any anemia, right? This symbolizes that bone marrow is hyperactive, proliferation is very high, right? Proliferation is very high, right? So because of that high proliferation, now bone is proliferating and they are forming the bony spicules which are perpendicular to each other. So that is why it is giving a hair on end appearance. So it can be seen in any hemolytic anemia. So what I want to say that it can be seen in any hemolytic anemias, right? It can be also seen in sickle cell anemia. It can be also seen in thalassemia and many other condition you can see. So it is not diagnostic finding, right? It is not diagnostic finding. It is a just suggestion that extramedullary hematopoiesis is going on, right? Now you can see this one is little bit important because if you look at the situation here, you can see the vertebra. अगर आप इस वर्टिब्रा को देखो तो कैसा दिख रहा है? It looks like a fish mouth vertebra. So this is a catch point, right? Fish mouth vertebra. So why there is a fish mouth vertebra? Because of the ischemic infarction, fibrosis, right? Infarction, fibrosis, fibrosis, infarction. So this sequence is going on in sickle cell anemia, right? So remember, it happens in sickle cell anemia. So fish mouth vertebra will be there because of ischemia, infarction, and fibrosis, right? So this is fish mouth vertebra, and on peripheral smear, you can see these are elongated sickle cells. So these are elongated sickle cells, right? So these are sickle cells. So now can you tell me what is your diagnosis? So our diagnosis is sickle cell anemia, right? So particularly examiner is asking about question regarding the sickle cell anemia. So in sickle cell anemia, now let us see what is true, right? Which is true and which is not true. So question is all are true except. So as I said, language of the question is very important in your exam, right? So now you tell me first option, commonly seen in Afro-American kids, true or false? Commonly seen in Afro-American kids. So that is a true statement. Commonly seen there, Afro-American kids. If you see images in the Robbins or in textbooks, you will find there is a pediatric baby who is African origin, right? That kind of baby will be shown in the images. So that image will be giving you one visual picture. For example, I will show you here. You can see this is how you can see the textbook images. Why I always say that, see the images, because images you will perceive and you will remember for a long time and in a proper manner. So now, as I said, it's a sickle cell anemia, right? As I said, it's a sickle cell anemia. So who will be affected by sickle cell anemia? So who is this? This is a pediatric case. He's a baby, right? So it's a pediatric case, right? So pediatric case you are seeing, and you if you look at the baby origin, he is looking like African, right? So because it is commonly seen in Afro-American origin, right? So we can say that Afro-American origin babies are commonly affected. So this was a question once upon a time in an INI-CT exam. Afro-American baby, right? Peripheral smear showing abnormal RBC. What will be the mutation you will see, right? Like that examiner will be asking you. So now you understood, this image will help you to understand pediatric patient, Afro-American patient, they are commonly affected by sickle cell anemia. And what finding we are seeing here? Can you see that swelling of feet and hand both is there, right? And this is called as dactylitis. This is called as dactylitis. This was a neat PG question. Question was simple. Dactylitis is seen in sickle cell anemia. Question was dactylitis is seen in which anemia? Sickle cell anemia will show you dactylitis, right? So this is all result of vaso-occlusive crisis, right? So because of dactylitis, what is happening? You can see there is this swelling due to inflammation, right? So due to ischemia, infarction, all these things are happening. You can see swelling is there, and it will be painful also, right? So it is called dactylitis. Sickle cell anemia will be showing you, right? So now by that picture you can remember, commonly seen in Afro-American kids. Hemoglobin solubility is altered. Do you think that hemoglobin solubility is altered here? Yes or no? Hemoglobin solubility is altered. Sodium diethionate is used for screening. right? So yes, sodium, if you look at the hemoglobin solubility, yes, it is altered. It is altered. See what happens in sickle cell anemia. What happens in sickle cell anemia? If you see the pathogenesis of sickle cell anemia, if you see the pathogenesis of sickle cell anemia, what you will notice, right? There is a point mutation, right? So now understand. So what is mutation? What is most common genetic change? Most common genetic change is point mutation, right? Most common genetic change is point mutation, right? And what kind of point mutation it is? It is a missense point mutation. Please remember, this was the question in exam, recently asked question, right? Missense point mutation. So now if you look at the name, what name says that sense has been altered, changed, right? So mnemonic is sick will miss. So sickle cell anemia will have missense point mutation. So this point mutation is very important. Sickle cell anemia will have a missense point mutation. Why it is called as missense point mutation? Let us see. Beta chain of 6 position of hemoglobin will be altered. So what will happen? Glutamic acid will be replaced by valine. Glutamic acid is usually negatively charged, polar and soluble. So glutamic acid, when you see, that is normal adult hemoglobin, right? So normal. Missense means it is because of the change in Piyush Solanki, for you I'm telling you. Missense means the sense of amino acid. See here I'm just explaining that amino acid here and amino acid here, because of this point mutation, has been changed. Their nature has been changed. And what is the change of the nature? They are now negative, polar and soluble, will become neutral, non-polar, insoluble, and that is what HBS. So that is why it is called as missense point mutation. Sense of amino acid has been changed. Previously it was soluble, and now because of the mutation it has become insoluble. That is called as missense point mutation, right? Non-sense point mutation, I will write it down for Piyush, I am writing, and for everybody. Non-sense point mutation. Please remember this point. When examiner says non-sense point mutation, non-sense means there is no change in the protein, right? There is no change in the sense of that amino acid, right? So who will do this? Non-sense can be done by stop codons. So please remember, this was the question in previous year exam, right? A stop codon. And who are the stop codon? UAA, UAG, and UGA. So you might be remembering in +2 also we used to study, right? Stop codons are there. So these stop codons are going to cause the mutation, and this will be seen in, please remember, this will be seen in beta thalassemia, right? So that is the point you have to keep in mind. In beta thalassemia you will find this nonsense point mutation. So that was the point I wanted to tell you. This was the recently asked question in exam, right? So Piyush, you understood? So nonsense point mutation, missense point mutation, both things are different. Missense, sense has been changed, they became insoluble, soluble to insoluble, right? Nonsense point mutation is because of stop codon mutation is happening, that is the beta thalassemia. Clear hai? Right? So this is how we can see, if you look at the sickle cell anemia, hemoglobin solubility is altered, right? Because HBS is insoluble now, right? Because of the presence of valine, right? And most common genetic change will be point mutation. And what kind of point? Because point mutation is seen in thalassemia also. Point mutation is seen in sickle cell anemia also. In thalassemia it is nonsense, and in sickle cell anemia it is missense, right? So it is a point mutation. So that is why this statement is a false statement, right? Let us see about the third option. Sodium dithionate is used for screening. So that is also a true statement. So here I will tell you one thing. When you do sickle cell anemia, right, there are two tests you should remember: screening and confirmation, right? So screening, already it is written sodium dithionate, so I'm just writing in short sodium dithionate. Apart from this, we can also use sodium metabisulfite. So please remember, sodium metabisulfite test. So sodium metabisulfite can be also used for the screening. So these are screening. But for confirmation, if examiner is asking, so please be careful, because this was the question examiner had asked recently. Your answer should be gene sequencing. Please remember, gene sequencing. Gene sequencing by which method? By polymerase chain reaction or by next generation sequencing, because it's a point mutation, right? So it's a very small thing. Yes, very good. It's a PCR. HPLC is not used, Anurag. Now it is not used. HPLC is not used, right? So HPLC is not used nowadays, right? HPLC, if it is not given in your option, then you can think about. Otherwise, examiner will definitely ask, and this was the previous year INICT question. In any hemoglobin disorder where you find point mutation, you should always use the gene sequencing or by PCR or by next generation sequencing. So please remember, this was the question, right? Please remember, this was the question in AIMS exam previous year, gene sequencing. And now you have to remember extra step, gene sequencing can be done by NGS, also can be done by polymerase chain reaction. So obviously next generation sequencing is superior to that thing. So that is the point you have to keep in your mind, right? So sickle cell anemia or any kind of thalassemia or any kind of hemoglobin disorder where you are finding any point mutation, like in thalassemia, right? Thalassemia also answer will be the gene sequencing, because they are having point mutation, right? So that is what you have to remember, right? So now you understood these important points. So we will be moving on to the last question. A 23-year-old male with chronic liver disease was evaluated and found to be having findings as given here. So I'll tell you, this question is a universal question. If you look at the recent INICT question, recent FMG exam, recent NEET PG exam, and that is also from past 3 years, in every exam they are asking. Every exam they are asking, you can close your eyes and you can tell the diagnosis. Now you tell me, by seeing this picture, what diagnosis is coming to your mind when examiner says this is the 23-year-old male with chronic liver disease and this kind of ophthalmological finding is given here? Tell me quickly. Answer should be, no, I'm not asking answer, I'm asking you diagnosis. Very good. Drinkle has told me diagnosis Wilson disease. Very good, Drinkle, Priya, Piyush, very good. And I think answer had been given already by Ishan Bansal, right? So here, one by one, we will see. So first of all, can you tell me what is this finding here? It's a KF ring. Very good, very good. Harsha has told KF ring. Very nice, very good. So it is a KF ring. Whenever you see a peripheral, you can notice here peripheral brown color. You can see from here, right? Peripheral brown ring is going on, yellow brown or brown ring is going on. So this is called as KF ring, right? Whenever you see KF ring in a chronic liver disease patient, you should suspect about Wilson disease. So now you came to know that our diagnosis should be Wilson's disease, right? So Wilson's disease is a metabolic disorder of liver because of copper metabolism, right? Copper is not getting metabolized properly, right? Copper is getting accumulated in liver, and that will be causing problem, because they will be accumulated in the eyes, they will be accumulated in the brain apart from the liver, and they will be causing liver, brain and eyes. These are the three areas which are commonly affected by them, right? So let us see one by one, right? Which of the condition is most likely to be associated with which of the following alterations? So can you tell me, first option, rhodamine stain will stain copper green, true or false? Green, true or false? Rhodamine stain is used for copper, but copper is not green, not green, not green. It's a false statement. What will be the color of copper? Color of copper will be red and brown. I will show you that picture also. Copper will be red or brown, right? So that point we have to remember. Micronodular cirrhosis. What kind of cirrhosis you will see? What kind of cirrhosis you will see in the Wilson disease? So in Wilson disease, you will find macronodular. So this is also a false statement. So we will see macronodular cirrhosis. So macronodular cirrhosis will be seen in Wilson disease. So this is also false statement. KF ring has no association with the neuropsychiatric symptom. True or false? This was the INICT question previous year. It's a line of Harrison. I will show you the table of Harrison also in the end. It's a true or false? It's a false statement, right? It's a false statement, right? It's a false statement, because whenever you see, remember one thing, whenever you see a KF ring, right, as an ophthalmic surgeon, you will become ophthalmic surgeon, or as a general physician also, you should always have a suspicion this patient is going to have any psychiatric problem or neurological problem. So they are 99% of the cases will be having. I will show you. This is the table of Harrison from where question has been framed. Now you can see that. Now you can see that KF ring. You remember what I have said? It's a Ames question. KF ring, right? It is present in more than 99% if neurological or psychiatric symptoms are present. You understand? So that's what we have to remember, that whenever you see the KF ring, you should have clinical application in your mind that this patient, more than nearly all patient will be, we can say like that, because this was the language used in exam. Approximately every patient will be having, all patient will be having neurological or psychiatric symptoms, right? So that is the point you have to remember. This is the table of Harrison, right? And this is the INI-CT question also previous year. So that is what I wanted to show you. So now degeneration of dopaminergic neuron, because copper accumulation will be in the basal ganglia, they will be causing damage, they will be leading to the Parkinson's disease, right? So that is why Parkinson's disease is damage of the dopaminergic neuron. So that is the true statement. So this is our true statement and correct answer. Degeneration of the dopaminergic neurons, and that will increase the risk of Parkinson's disease, right? So this will increase the risk of Parkinson's disease or Parkinson's syndrome, right? So that is a true statement. So this is our correct answer, right? So let me explain you a little bit more about this Wilson disease, because it's a very commonly asked question. It's an autosomal recessive disorder, right? It is an autosomal recessive disorder, metabolic disorder, which chromosome 13. Remember, Wilson is associated with chromosome number 13, long arm, right? 13q, chromosome 13q, how it is associated with Wilson disease? If you see, you will find that ATP7B gene is present on chromosome number 13q. Understand? So what is the normal function? So first I will tell you what is the normal function of this ATP7B gene. So normally ATP7B gene is helping in ceruloplasmin synthesis. Understand? So please understand this point. Normally chromosome number 13q, which is having ATP7B gene, they will help in synthesis of ceruloplasmin. And what is ceruloplasmin? Ceruloplasmin is a carrier protein for copper, right? Carrier protein for copper. So what they will do, they will combine with copper. So you can see that copper is going to combine with ceruloplasmin. After that, what will happen? This will be getting biliary excretion. So that is the normal function of the ATP7B. But because of the 13q gene mutation, or because of the ATP7B gene mutation, because mutation is happening, so ceruloplasmin synthesis will be decreased. If ceruloplasmin is decreased, what will happen? Their combination with copper will be also decreased. So copper combination with ceruloplasmin is decreased. Ceruloplasmin decreases, their combination with copper decreases, and because of that there is a decrease in copper biliary excretion. So if copper is not getting excreted via the bile, what will happen? They will get accumulated into the liver. If they are getting accumulated into the liver, that what they will cause? They will cause liver disorders. So that is how liver disorder will happen. So liver disease will start, and that is what we are calling Wilson disease. Apart from this, this copper can cause also damage to the RBCs, and that will result in hemolytic anemias. So whenever you have an excessive copper accumulation disorder, you please have this in your mind, because it is not only for the MCQs, for your clinical life also. Whenever you see a liver disorder with hemolytic anemia, you suspect about Wilson disease. Now understand why I am saying this is a dictum. This is a clinical dictum. Liver disorder with hemolytic anemia, suspect about copper associated Wilson disease, right? So how you are going to see these patients? These patients are usually in the range of 6 to 20 years of the age group, and clinical feature, as I said, there will be a liver, brain and eyes which will be damaged, right? And in this question I have shown you eyes involvement, where I have shown you Kayser-Fleischer ring. So Kayser-Fleischer or KF ring is present in the cornea, and it is present in the decimate membrane of the cornea, right? And they will be appearing yellow or brown in appearance. When you will look at the brain, what you will see in the brain, as I said, they will be causing accumulation into the basal ganglia. They will be causing damage of the basal ganglia. In basal ganglia nucleus, that putamen, they will be causing atrophy of the putamen, and that is why Wilson disease is also called as hepatolenticular degeneration. Please remember this word. The question in exam: hepatolenticular degeneration is another name of Wilson disease because of the putamen damage by the copper accumulation. Because of the dopaminergic neuron damage, they are associated with Parkinson's disease also. So that was the right answer. You remember Parkinson's disease, what will happen in Parkinson? There will be decrease in dopaminergic neurons. So that will be damaged by the copper accumulation. So that is why we can say that Wilson disease is a risk for future Parkinson's disease. I will tell you one clinical scenario. Whenever I have seen neurologists, some of my neurologist friends, whenever they will be examining this Parkinson disease, they will always check the ceruloplasmin level. You know why? Because they wanted to rule out earlier case of Wilson disease. Now understand why examiner is asking this question or why examiner is pointing, because these are common clinical practice. Whenever Parkinson patient comes, we check ceruloplasmin level to rule out Wilson disease as the cause of this Parkinson disease. Now understand? So that is what you need to remember. As I said, liver will be damaged because of copper accumulation. So liver damage will be having all spectrum of damage: acute, chronic, fulminant, all kind of damage, right? Macronodular cirrhosis, that was our answer, right? Micronodular was given, but remember what we will see here: macronodular, and Mallory Denk bodies will be there. So liver, brain, eyes, all will be damaged. When you have to diagnose this case, you have to understand in diagnosis there are three things: most specific, gold standard, and special stain. So most specific is urinary copper excretion, which will be increased in case of Wilson disease. Gold standard is liver biopsy, how much it should be. Copper accumulation should be increased up to more than 200 microgram per gram of liver tissue, right? So please remember, more than 200 microgram per gram of the liver tissue. This is important value given in Harrison also. Special stain: rhodamine stain will be used, and rhodamine stain will be showing you copper in a red brown color, right? Serum ceruloplasmin will be decreased, but remember, serum copper is not diagnostic, non-diagnostic. Please remember, this was the older AIMS question, so that can be also repeated in our NEET exam, right? Now you can see this is the Harrison table. So number one thing which you should remember is Kaiser-Fleischer ring, more than 99%. If you find KF ring is present, so 99% or approximately all patient will be having neurological psychiatric problem, right? Liver copper level is more than 200 microgram, because some books are differing from here, so it is Harrison, so we will follow this one. And DNA testing, when you will do, or you can say PCR, you have to check for the ATP7B gene on 13 long arm, right? So these are important things. Now you can see clinically what I have shown you here. You can see here there is a peripheral brown color ring. So this yellowish brown ring is the KF ring, which will be present in the cornea. And in cornea also, which layer of the cornea? Decimate membrane. So that is the question which examiner asks in your ophthalmology also, right? Decimate membrane, it will be present, right? Now you can see this is the rhodamine stain, special stain for copper. Please remember, rhodamine stain is a special stain for copper. It's a special stain for copper, and you can see in this liver biopsy, all copper is how it is looking like. It is reddish brown in appearance, right? So this is how we will say it is reddish brown in appearance. So these are all about today's thing. So as I said, whatever I have shared here in the PDF, now I am going to share that in my Telegram channel within 10 minutes, right? So please watch this and just scan this and just follow my Telegram channel. You follow my Instagram also, because in Instagram, if I'm daily using one hashtag, you can see OLR, one line revision every day, and some of the pathology images, exam strategy. There are many things. You can see my Instagram, and it will be immensely helpful for you for your upcoming exam, right? And just watch it. YouTube, you are seeing me, right? So now YouTube, I will be keep on conducting these kind of high yielding shorter sessions are there. It will be very helpful. These shorter sessions, I am just including those things which had been asked previous year. So these are actually PYQ based topics. So these topics are important. Master them. You will definitely get a very good rank in your exam, right? In pathology, I can assure you, you will not be having any worry about any images or something. I'm going to discuss like that, right, regularly. So please follow this, and please follow my Instagram, and just go through with all these OLR, because these OLR are the PYQ based OLR. These are all previous year question. So just 50-second or 15 seconds or 20-second video will be there. That will be question, that will immediately you will understand when you will be writing in your exam. You will understand, oh, this was the thing which we have seen in that videos, very small video, right? So that is one thing which I would like to say. And second thing, in YouTube you can see hashtag HYS. I have kept approximately 117 YouTube videos. You watch through this. These are 1 to 2 minutes of the videos, but they are very concise and they are having many high yielding things. And in this aims also, I have seen there were approximately 15 to 20 question came from this HYS only. These are very very powerful. I'm telling you, once you go through the HYS when you're going into the mess, or when you're going to the while traveling through the metro station, just watch these 1 to 2 minutes of the clips. It will immediately help you. You will understand, this will help you a lot in your exam. So keep attending all these things, write all your grand tests, revise your notes, keep working hard, trust in your abilities. You all are good and you will definitely succeed in your exam. So thank you so much to all of you, and my best wishes.